Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. We're doing this program at the Alan B. Levan Innovation Center, which is a combined effort between Nova Southeastern University and Broward County. And we're very pleased to have you here today. As I've told most of you who have been long-standing viewers of the program, the three most asked about questions have always been cancer, cardiac care, and minimally invasive techniques. Well, we're going to talk about two of those right here because I have one of really not only locally but America's great cardiovascular individuals who deals with cardiac care. And let me introduce to you Pedro Martinez-Clark, MD. Welcome, Dr. Martinez-Clark. Welcome.
It's a pleasure for me to be here. I'm so excited about this program.
Yes, sir. I know that you're a founder of Amavita Heart and Vascular Health, and that's a group of venues that are affiliated with various hospitals, correct?
That is correct, exactly. So what I've been in practice for about 15 years since I graduated from fellowship. And I did my fellowship in Boston, and I came to Miami, to South Florida in 2007, 2008, and did the first 7 years of my career working in the academic environment, teaching, clinical research, the typical kind of academic structure career, obviously clinical practice as well, and doing a lot of interventional cardiology cases. And that was at the University of Miami. And then I decided that I wanted to create my own thing, my own style of practicing medicine. And I saw an opportunity where there was a lot of consolidation in the market by the different health systems. In South Florida, I saw an opportunity to create a different type of experience, if you will, for the average patient. And that was my philosophy. I think of Amavita as kind of the JetBlue for cardiovascular care. So, very well priced, very good experience, regardless of income levels, whatever. That's kind of the same model. So Amavita, our offices are conveniently located. We wanted to provide an experience that was full of hope, positive energy. I kind of wanted people to feel happy to come to see a cardiovascular specialist and not to have that kind of negative connotation of, oh, I'm sick from the heart, I have a cardiovascular condition, whatever. I wanted to be an environment that was filled with positivism and hope. And that's kind of the experience that we provide here. We have very nice ambient music. We have a specific smell that we have for the brand. It really is a different type of experience because that's what it's all about, right? I mean, it's making healthcare obviously affordable and accessible, but also making sure the patient, which is the consumer, has a very good experience as they navigate through a complex system.
Cardiac care is an element of the most important nature because without an appropriate cardiac activity, everything else doesn't count. So, in essence. So I'm really interested. Amavita has venues throughout South Florida?
Well, so far we have concentrated in Miami-Dade County. And when we wrote the business plan, obviously the business plan has a 5-year plan and a 10-year plan. And the idea is to be able to create a model that can be replicated in the entire South Florida and maybe even perhaps nationwide. But right now we have offices in all the way from South Broward to Kendall. And we have an amazing, beautiful, which is going to be our flagship location, which is going to be a Miracle Mile. But obviously with the proper funding and growth and so on and so forth, the idea is to replicate this model in a broader region. So that's the plan. But you touched on something very important, which is the how do we keep all these over 65 years of age people healthy, right? So you touch only, then you kind of alluded to the fact that there is a whole field of medicine now that is becoming very relevant, especially in my opinion here in South Florida, which is longevity medicine. And longevity medicine is starting to become a real science, the science of aging and the science of understanding what happened to the aging process and trying to understand more the health condition, not so much the disease condition or disease state, and trying to intervene in a way that allows those 70-year-old people to be completely functional and completely active and be a very, very important part of society, because those 70-year-old people that you're referring to, they want to be active, they want to participate, they want to feel that they contribute to society. And for that, they need to make sure that all the organ systems work, from memory and mental health, from memory, etc., from mental sharpness to cardiovascular fitness, to joints, to tissues, to dermatology, everything. So longevity medicine is becoming an important aspect of modern medicine.
Well, that's very important. The issue, and again, the viewers have been very kind over the years to send us notes or ask questions. I don't give them the answers. The people who are on the program give the answers. That's why we ask people to be in front of the camera. The reality is, though, we have grown so dramatically in the last 30 years. We've gone from the 10th largest state in the union down to the second largest state in the United States. But the greatest number of growth is, believe it or not, it's two areas. It's the people over the age of 70, and believe it or not, it's from birth to age 5. I'm very pleased to know that Amavita is expanding. I can only say to you candidly that Palm Beach County is in a growth spurt, and there are a lot of people in Palm Beach County that are over the age of 70. So that's just a point that I'm making. I'm sure you're aware of it.
We live in exciting times in Florida, and especially in South Florida, because of the population growth. We see it in practice, we see it in small businesses, we see it in traffic, we see it everywhere. And that's exciting, but it'll also bring some challenges, right? And some of those challenges are, how do we deliver appropriate and affordable and easy access healthcare to all those individuals, and to support that population growth. So you're absolutely right.
How does one receive services from Amavita? You have to be referred by a cardiologist or an internal medicine?
Sure, yeah. I've always believed in a direct-to-consumer, right? So I think the patient should have the power, just like the client, right? So you should be entitled to buy your bread bakery A or bakery B, or have your coffee from a Starbucks versus Dunkin' Donuts or whatever. You should be able to choose. So to that extent, we've always thought that the patient should have the choice to go to whatever cardiovascular specialty or specialist or provider they wish to. Unfortunately, in the United States, we are limited by the payers, right? So one of the things that has happened to healthcare is the increase in administrative burden. And that increase in administrative burden has created a lot of barriers for patients to access practices or clinics or networks like ours, for example, because the payers may or may not be contracted in a preferential way or not with practice A or network A or B. So that creates a limitation to that sort of free market dynamics that one sees in other industries. So that's a long answer to your question, but the short answer is it depends on the specific plan that the patient has. A lot of the plans require a referral from the primary care doctor. Especially here in South Florida, we have a lot of managed care because of the aging population or the population over 65. There are a lot of HMOs, Medicare HMOs plans, Advantage plans. Lots of those plans are very referral dependent and authorization dependent. So that creates that layer of complexity to that free flowing of patients.
Yeah, well, that's where I often talk. I spoke to some of our student leaders, and I used the word medicine has become corporatized. And I'm not talking about your corporate entity, Amavita. I'm talking about just what you just referred to, that you need to get this approval, to get this approval, to get this approval, to get to you. And that's an unfortunate occurrence.
Yes, because if you think about it, this is an example that I tell young physicians all the time that work with us, that I love mentoring, I love mentorship, I love teaching, I love to kind of give back, because I've been blessed with amazing mentors. I wouldn't be what I am today without the help of several mentors that I really, really hold very close in my heart. So I'm grateful to that, and I want to give back. And I love having students, fellows, young physicians. And I really, if a young physician wants to start practice, I don't really see it as competition or anything like that. I really try to help whoever I can, because that's just the way that my philosophy, And the example that I give to young physicians is medicine. If you think about it, it's a very unique industry in the sense that if you go to a Starbucks and buy a coffee, it's a transaction between you and an entity. It's a two-part transaction, meaning two individuals are in that transaction. If I buy a car from you, you want to sell me your used car, I'll buy it from you and I'll give you X amount of money and I get the car and we're done. Medicine is different in the sense that I provide a service to you, but there is a third party that pays for that service. So it's a very weird dynamic. You are the client and you're the consumer, and I'm the provider, but you want something, I want to give you what you want, and we're in agreement, but the payer is the one who really has to be in agreement because he's the one that pays. And what you want and I want may not be aligned all the time with those guidelines and rules and so on and so forth. And that adds a significant level of complexity, and it's hard for young physicians to understand those dynamics, and it's frustrating for the patient to be able to to have to be subject to those dynamics sometimes.
Someone comes in, they had an accident, they had a fall, whatever, and they're waiting for approval. It's unfortunate.
Very, very specific example. For example, the issue of lower extremity amputations in the United States. And there is if you look at lower extremity amputation, it's terrible, absolutely terrible. It's damaging to obviously the patient. Is terrible for the family, and it's a marker of mortality. In other words, if you have an amputation, even if it's a short amputation or a more extensive amputation, your mortality goes up significantly, and for many reasons. And if you look at the number of non-traumatic amputations in the United States, have been going up over the last decade or so. So the American Heart Association actually came up with a position statement to try to reduce the number of non-traumatic amputations in the United States over the next 10 years. And when you really study the topic, you notice that the reason why non-traumatic amputations occur is because it's exactly that example, is because there is lack of awareness on the patient and the provider side about all the non-invasive techniques and procedures that we have available today to be able to restore blood flow to the lower extremities in a way that is really minimally invasive, very, very safe and effective, in that allow us to give the opportunity to a patient to restore blood flow to an area, tissue area that is at risk. So, and that's the perfect example because of all those dynamics playing to a very specific disease state, which is an example of what you just mentioned.
Dr. Pedro Martinez-Clark, I know that you work, and we're going to have Dr. Alan Stewart back, but I know you work hand in glove with him on many issues. And I also know that he's the medical director for HCA's East Florida cardiovascular surgery program.
When Dr. Stewart came, I thought it was a good opportunity to try to support the hospital and align our practice with Mercy Hospital, and that's what we've been doing. And Dr. Stewart and I share a similar vision, and we want to do things together, and we complement each other well because his specialty complements mine, and mine complements his specialty. So we do a lot of procedures together, and we work in a lot of patients together as well.
Well, one of the things, you know, I know that you worked for a long time with Jackson
No,
Memorial.
no, absolutely. And the role of that Jackson Memorial Hospital plays in Miami-Dade is huge, and it's I mean that's you know, no argument there. The hospital is amazing, and what they do is incredible. The work that they do in vascular polymer is second to none in the country. The trauma unit, the burn unit. I mean, so many, the transplant team, the transplant program. I mean, so many good things about Jackson Memorial. And the impact for all of us that live in South Florida is important that institutions like Jackson Memorial thrive and stay you know, accessible to all of us, because you know, honestly, if, God forbid, in a trauma situation, there is no second place. There's no other better place than to be at Jackson, honestly.
Where in, since we're located here in Broward and really Palm Beach, I don't believe you said that you had any Amavita venues in Palm Beach, but I do know you have some in Broward.
Yes, we have our most northern location is in right now is in Aventura. In Aventura, we have both an office and we have a surgical center that is opening. The surgical center is currently in construction. It's opening in they say more or less around Thanksgiving. So that surgical center has been an amazing project because, as you may be aware, there is a push to try to do more outpatient procedures, less hospital procedures, because because the outpatient procedures in surgical centers are cheaper. Our healthcare cost is very expensive as a nation, and shifting some of those procedures to the outpatient setting as an ambulatory surgical center lowers the cost. And also because patient experience is better and greater. So there is a significant push that Medicare has to try to move as many as possible.
Getting back to you and the issues, what's really interesting, I go back to my initial couple of sentences. The people that are watching are so interested in minimally invasive techniques because obviously now that you're talking about doing it in non-hospital venues but in surgical units, you mitigate the main issue which the viewers talk about. I don't want to be in a hospital for 2 weeks. I don't want to be bleeding. I don't want to be hurting, et cetera, et cetera.
I can give you very specific examples where we have grown tremendously in minimal invasive techniques. One of them is valve replacement, right? Valve replacement and valve repair. For example, the aortic valve, the most common condition is aortic valve stenosis, where the aortic valve is narrow. And it's narrowed because you either were born with a defective valve that promotes calcium formation in deposits in that valve, or because for whatever reason that we still don't understand very well, after 65 years of age, you tend to deposit a lot of calcium in that valve, and you were born with a perfectly normal calcium, just deposits there and the valve closes down, and there is significant restriction to blood flow. And that's a terrible condition because it has a very high mortality. Patients feel very lousy. You can have syncope, meaning pass out in very dangerous situations, etc. And traditionally, that condition is treated with a big operation, cardiac operation, sternotomy, lung recoveries, etc. Now we can offer a valve replacement with a minimal invasive procedure that literally in a low-risk patient can be a 20, 30-minute procedure. done in a way that is very, very safe. And I can totally see the day in the very near future where percutaneous aortic valve replacement will be an ambulatory procedure, or at least because now we do it in a way that is just a one-night hospital stay. And for low-risk patients, we do it like that mostly for regulatory purposes. But the procedure, and that's a beautiful example of the advancement of medicine and the transition and the shift to minimal invasive techniques. Also on the surgical side, if a patient is not a candidate for a percutaneous aortic valve replacement, there are minimal invasive techniques that can be done on the surgical side where the valve can be completely repaired without having to have a sternotomy. It can be done from a medial lateral thoracotomy where the lung is deflated and then moved out of the way, and then the aortic valve is just right there and the aortic valve can be replaced. And the same technique can be used to repair the mitral valve from a minimal invasive approach. It's beautiful because I see those patients and you see no scar and the recovery is amazing. So those are very, very specific examples. Another example, for example, is the one that you mentioned, bypass operation versus stents. The stents that we have today are so incredible. We have very small stents, we have big stents, we have long stents, short stents, we have different metallic combinations that allow the stents to have significant flexibility, that allow us to deliver the stents to very complex anatomy, and really allowing us to treat patients that before, even 5 years ago, let alone 10 years ago, couldn't be treated with traditional percutaneous techniques. And also, in another example would be the treatment of peripheral vascular disease, which is the arteries, the blockages in the arteries of the lower extremities. Before, bypass operation in the lower extremities for claudication or for critical limb ischemia, meaning advanced peripheral vascular disease, the treatment of choice was bypass operation. Now, bypass operation in the lower extremities, and I have many vascular surgery friends, and they hate me for saying this, but the truth is that it's a terrible operation. I mean, it's really, it's just a really tough recovery. It's a long procedure. It's really a complicated surgery. It depends a lot on the surgeon as well. Obviously, some surgeons have much better outcomes than others. It's a very delicate technique. Whereas we have advanced a lot on the endovascular treatment of peripheral vascular disease. With a 2.5 millimeter catheter, we can treat most of these conditions. So those are very specific examples of how minimal invasive techniques have progressed in a way that that it really allows us to offer patients techniques, options that are very short recovery, very little downtime from work, obviously less pain and less disruption to the entire family, right? Because that's also something that you have to keep in mind. What is the family situation? What is the support system that a patient has? And that's a factor that has to play in the decision making when you offer a minimal invasive procedure to a patient versus a major operation. That patient may not be the most ideal candidate for a minimal invasive procedure. It might require a bigger operation, but if the patient has very poor family structure or social structure, that surgery is not going to go well because the surgery is only as good as your recovery. So these are all factors that you kind of have to play and put in a balance when you decide what technique or procedure you're going to offer to a specific patient. But overall, I will say that amazing times we live in cardiovascular medicine is still one of the specialties with the fastest innovation and advancement, and we have the benefit of having very long history of clinical trial data. So we are very confident and sure of the science in the data because we have all these clinical trials for many years, and that allow us to really make decisions that are as close to the truth as possible.
We're down to the last couple of minutes of the show. I just want to, as I always tell our viewers, You know, you just can't go into a supermarket or a pharmacy, pick something up off a shelf because you have a little pain in the shoulder, you don't know what it's all about, you got a little indigestion, you think you have indigestion, you're walking up some steps and you're not breathing right, you take something, don't do that. You know, I'm not knocking anything, but the bottom line is you have to talk to your doctors. You have to talk to your doctors. They're the ones who will direct your care. They're not looking for you to come to them because they need you as for their income. They need you to be able to take care of you. So you've got to get to your doctors. Dr. Pedro, yeah, 100%. Dr. Pedro Martinez-Clark, you're terrific. Bless you. I'm glad that you have ended up in the South Florida area. We appreciate your time. I know that the viewers appreciate what you had to say. And remember, folks, as I always say to you, if you have any questions, you have any comments, there's an email address right here. All you have to do is just send it. I won't give you the answer. We'll just send it on to individuals like Dr. Pedro Martinez-Clark. It's up to him what he would like to advise you one way or the other. But I implore you to use the capabilities of the medical profession that's out there. Don't try to do it yourself. This program is called Dateline Health. My name is Fred Lippman. Until next time, see you.